And I think the important part that we should look at is this is about people. And this debate is about people. First, second and third. And it's not about anything else. And a decade on from the passing of the Gender Recognition Act, we have a lot of road to keep going as a country. And I, as a member of the LGBTIQ+ community, respect everybody. And Deputy O'Donoghue, you're right. Fear is driving some of the narrative. And that fear is caused by some. And they have to reflect upon their articulation of points. Can I welcome the members in the public gallery today and thank them for being here and for their battle. And it is a battle that they shouldn't have to engage in terms of trans healthcare. And that's something we need to reflect upon as a country and as a society. Because as the motion before us in the Labour Party reflects, stories. And the sad part is some of the comments this morning, Cathaoirleach, will get in the paper. But the real story is about the stories of the people in the gallery here today and their quest for health care. And I would make the point to all of us as members of the Oireachtas, irrespective of ideology or viewpoint, to reflect upon what we articulate, how we articulate it, and what we say and when we say it. And I get emotional, Cathaoirleach, when I hear some of the inflammatory language being used. Because nobody wakes up today and suddenly flicks a switch and transitions from man to woman or woman to man. It doesn't happen. And if we're to have a debate in this House, let's do so in a manner that's honest in terms of engagement on the issue of transgender healthcare. And I want to pay tribute to Minister Carol McNeill, but also to Minister Butler, through her own lived experience, for the way she has ensured that we can have, at the heart of government, a movement towards that piece that's been missing since the Gender Recognition Act. Members of the transgender community deserve comprehensive, respectful, integrated care and the support they need to live their lives authentically so that they can flourish. And when we talk about the percentage of people or the numbers of volumes, it's actually quite small. There isn't going to be, and I won't say what I was going to say. Both Minister Carol McNeill and Minister Butler and Minister Carol McNeill today have openly acknowledged the current public service in Ireland do not meet fully the needs of people seeking gender-affirming health care. And I'm glad that government are not opposing the Labour Party private member's motion today. And I want to thank the members of the Labour Party for bringing this forward. There's a key word, Cathaoirleach, or phrase that we should focus on. Gender-affirming healthcare. It isn't doing what you're saying, Deputy Tobin, at all. Not at all. And I respect you, Deputy Donoghue. I know you to be a decent, honourable man. But let's listen to the stories as we pursue a willingness, as you said, to listen to the experiences and the huge gaps in the services. And think about those gaps in the services. It's affecting people. On dinner, people being judged, people being harassed, beaten, chased, mocked, jeered, condemned by a republic that's meant to treat all of our children equally? And leaders of parliaments, by your words and actions, bring people. And that's why, for me, Cathaoirleach, this debate is very important. Because we must, as a society, bring about meaningful improvements for every person that wants gender-affirming healthcare. And let me tell you, members, if we're to be honest, and Deputy Donoghue mentioned that he has friends of his who are transgender, they're not ogres, they're not demons, they're not predators. You shouldn't have to say that. You shouldn't have to qualify that. They're decent people, professionals, ordinary people, trying to live their life as best they can, making a valuable contribution. And walk in their shoes for a couple of days and see the reality of life. And they're coming into your office to talk to you, friends of yours struggling with mental health, struggling to gain basic health care. And for me, working with, I hope, like-minded people, that diversity of experience will bring about change, but also bring about awareness. And you mentioned education. You're right, it's not education, it's raising awareness in that new clinical programme for gender healthcare. And that programme must be about best practice from around the world, recognising that there has been an increase in the demand for transgender healthcare services, but also reflecting a growing societal understanding of a gender diversity and commitment to supporting people at every stage of their journey. And that's why both Minister Carmack and Minister Butler are very much steadfast in their belief that the new clinical programme will be instrumental in establishing a fair, balanced and effective system for gender-affirming healthcare in Ireland. We cannot ignore the inclusion of people with a real lived and living experience. Their viewpoint, informed by the direct personal involvement with the healthcare system, is not just invaluable in shaping a model of care that is responsive, but it's critical. And yes, there will be people with different viewpoints, but collaboration is needed. The process, in terms of what we're looking for, is about active engagement with healthcare professionals, advocacy organisations and other relevant stakeholders. And what does it do? It brings us to a model of care that reflects the full spectrum of needs and perspectives, paving a way for a system that is both truly inclusive and effective and delivers for people who need it. And transparency is also a key principle that will underpin the programme's development. I didn't hear all the debate, Cathaoirleach, but I'm very acutely aware that information and support among gender questioning young people and their families is one that we have and need to do more on. To say that the unique challenges to navigating the complex social, emotional and medical issues in a world sometimes that is cold, where understanding and acceptance is very limited, is difficult. And so the broader model of care must be refined to recognise the urgency of the situation, and I hope the HSE will continue that. In conclusion, could I ask all of us, through a continued collaboration based upon evidence, based upon the stories of people, the lived experience, but above all, based upon the focus on inclusion and respect, that we can and should make a substantial and positive difference in the lives of people, and in particular, those we serve. The clarion call from this debate, Cathaoirleach, is that together, let us move forward towards a future where every member of the transgender and gender diverse community can access the care, the support and the recognition they deserve, and at the very least they need to continue to live their best lives. We owe them that as members of a republic, as citizens of a republic. Gurmagat.